Hello, I'm Dr. Lesley Dawravoo, and I'm a gastroenterologist at GI Partners of Illinois. Today I'm going to talk to you about irritable bowel syndrome, which is one of the most common disorders of the GI tract. Irritable bowel syndrome, also known as IBS, is characterized by chronic abdominal pain and a change in bowel habits. IBS is one of the most common referrals to a gastroenterologist and affects between 10 and 15% of the population of the United States. IBS can happen to anybody, but we do see a higher predominance in females and in young adults. So what are the symptoms of IBS? Like I said before, IBS is characterized by a chronic abdominal pain. This is typically a crampy type of abdominal pain that is not specific to one area of the abdomen. The abdominal pain is generally associated with a change in bowel habits, whether that be diarrhea, constipation, or a mix of both diarrhea and constipation. Patients can also develop bloating and gas. IBS symptoms generally happen 1 to 2 times per week and have been going on for at least 3 months. So how do you diagnose IBS? Well, there is not one specific test to diagnose IBS, but your gastroenterologist will probably check some basic blood work. This would include a blood count, which will look for signs of anemia or infection. If you're presenting with diarrhea, they may also check a stool test to look for infection. Patients may need a colonoscopy, particularly if you're over the age of 45, and this is to look for other diseases like Crohn's or ulcerative colitis. What shouldn't you see in IBS? Well, patients with IBS should not be having large volumes of blood in the stool. If this is the case, you should have further evaluation to look for something else. In addition, patients with IBS should not be having symptoms that wake them up frequently from sleep, which we call nocturnal symptoms. They shouldn't be seeing unintentional weight loss or abnormal labs. So how do you treat IBS? Well, lifestyle modifications are a big part of it. Let's talk about exercise. So in patients with IBS, regular exercise, meaning exercise 3 to 5 times per week, was associated with a reduction in IBS symptoms. What about diet? This is also a large part of IBS. Patients with IBS may want to keep a food diary to look for common triggers for their symptoms. They may also want to see a dietitian. Your gastroenterologist will most likely give you a low FODMAP diet. This is a diet that's low in fermentable foods like beans or high fiber vegetables, things that can cause a lot of gas and bloating. Patients with IBS in general should limit caffeine, limit fried and fatty foods, and may even want to limit gluten and dairy. What about fiber? So fiber sometimes can cause gas and bloating, but studies have shown that in patients with IBS, a fiber supplement is actually helpful. We recommend a soluble fiber like over-the-counter Metamucil or Benefiber. These are safe to use on a daily basis. I generally would recommend that you start with just a few grams per day and gradually increase to the recommended dose. Medications can also be used for IBS. So if you're presenting more with constipation, the mainstay of therapy is osmotic laxatives. In general, we would first start with over-the-counter Miralax, which is safe to use on a daily basis. If this isn't working well for you, your gastroenterologist may recommend osmotic laxatives that are prescriptions like Linzess or Trulance. If you're presenting more with diarrhea, you may just want to try a simple over-the-counter antidiarrheal like Imodium. Also, you can talk to your gastroenterologist about prescription medications like dicyclamine, which can help with abdominal cramping and diarrhea. Or you may want to discuss rifaximin, which is a non-absorbable antibiotic that helps with IBS diarrhea. I always recommend a probiotic in my IBS patients. Probiotics are basically just healthy bacteria that can make for a more favorable gut microbiome. I kind of like to think about it as a vitamin for the GI tract. Lastly, you want to make sure you have a trusting doctor-patient relationship. You want to make sure you're comfortable describing your symptoms and going over a plan for good gut health. Thank you so much for listening today. For more information, please visit our website at gipartnersofil.com.